Did you ever wonder why metformin is so commonly prescribed? This seemingly simple pill carries a complex pharmacological profile that makes it a cornerstone of diabetes management. Today, we delve into the world of metformin, exploring its actions, indications, dosage, side effects, and contraindications. Metformin, a biguanide derivative, is one of the most well-known oral hyperglycemic agents. Its primary action is to decrease hepatic glucose production and increase insulin sensitivity in peripheral tissues. This dual action not only helps lower blood glucose levels, but also improves the body's overall response to insulin. In addition, metformin does not stimulate insulin secretion, a feature that helps avoid the risk of hyperglycemia, a common concern with other diabetes medications. The main indication for metformin is type 2 diabetes mellitus, especially in overweight or obese patients. It's also used in the management of polycystic ovary syndrome, a hormonal disorder common in women of reproductive age. Another less common but noteworthy use of metformin is in the prevention of diabetes in individuals with prediabetes. The dosage of metformin is tailored according to each patient's individual needs and response to therapy. However, a typical starting dose is 500 milligrams twice a day or 850 milligrams once a day, with the dose gradually increased to a maximum of 2,500 milligrams per day, depending on tolerance and efficacy. But like any medication, metformin is not without side effects. The most common are gastrointestinal disturbances such as nausea, vomiting, and diarrhea. These usually occur at the beginning of therapy and often lessen over time. A rare but serious side effect is lactic acidosis, which is more likely to occur in patients with certain risk factors such as kidney disease, liver disease, or alcoholism. Speaking of risk factors, there are several contraindications to the use of metformin. It should not be used in patients with severe renal impairment, acute or chronic metabolic acidosis, or a history of hypersensitivity to metformin. Caution should also be exercised in patients with liver disease or alcoholism. To summarize, metformin is a widely used drug with a dual action of decreasing hepatic glucose production and increasing peripheral insulin sensitivity. It is primarily used in type 2 diabetes, but also has applications in polycystic ovary syndrome and prediabetes prevention. Its dosage is tailored to each patient, with gastrointestinal disturbances being the most common side effect. It is contraindicated in severe renal impairment, metabolic acidosis, and hypersensitivity, with caution needed in liver disease and alcoholism. This humble tablet, metformin, thus carries a significant weight in the world of medicine. It's a testament to the power of pharmacology, the ability to harness chemical compounds to improve and save lives. The journey of understanding metformin is a perfect example of how intricate and fascinating the world of medicine can be.